Hello, my name is Dr. Richard. I'll be your faculty in this very important course, Healthcare Management. In this course, we'll explore the origin of healthcare management and administration all the way to our present time, starting from the 17th century, and the reason why the clamor for universal healthcare. We will explore all that, starting from the origin down to the present time. Now, for starters, we're going to be looking at the evolution of healthcare management. Now, like I said earlier, healthcare management actually started in the 17th century. Now, the eye-opener that orchestrated the universal discussion on healthcare management started with the pandemic of the 17th century. That kind of rings a bell that we are actually coming out from a pandemic or trying to step away from the pandemic of this century. But the discussion on healthcare started in the 17th century, and now in the 19th century, there are several advancements on public healthcare measures. That means the governing bodies in the society started talking about how to protect citizens in the community in a public arena, because they understood that what affects, especially when it comes to communicable diseases, it is something that no one can insulate himself or herself. So there has to be a unanimous drive to be able to protect one another. That's where the advancement on public health measures started. Now, during the 20th century, the government role in public healthcare service expanded. Now, the birth of the World Health Organization also came in place, and the healthcare started ranking individual countries on how well they're able to manage their healthcare system. Now, the healthcare system ranking and discussion continued all through the 19th century. Now, moving on, healthcare services around the world, we're going to explore how different countries and continents around the world have actually been managing the healthcare system, starting from the United States. In the United States, the healthcare system, there is a mixture of both public and private funded programs. That means there's a little bit of PPP, there, public-private partnership, that also exists in the United States as regards to healthcare system. Now, because of that, the prices are a little bit inflated, especially when you go to the private healthcare institutions. I'm talking about this because I used to manage one. And in the UK, it's a little bit different. In the UK, the population is covered by what is called the national healthcare system. That means every citizen in the United Kingdom is being covered by a huge umbrella system called the national healthcare system, which consists also the public, private, and also the non-profit hospitals. So technically, they're all under the auspices of the government of the UK. Now, moving on to the European Union, they include citizens irrespective of paying capacity. So technically, it's kind of similar to what exists in the United Kingdom. In the European Union, all the citizens are all covered irrespective of their class in the society. Now, let's move on to Asia. Healthcare systems are a combination of public and privately managed system. In Australia, tax-funded systems of public health insurance program also exist. So that means the taxpayers actually fund the healthcare system in Australia. And these programs are also known as Medicare, and citizens get free care of services and drugs in public hospitals in Australia. Now, in Africa, private healthcare system is characterized by high prices. That means the private hospitals and private clinics in Africa there's no price control. It's always, most of them are there to maximize profit, and low to income individuals in Africa usually patronize the public healthcare system where the price is a little bit affordable. So over there, it's kind of similar to what exists in the United States, where there is the existence of the private healthcare institutions and also the public ones, and the prices kind of vary. All right, now moving on to the summary of what we have learned today. There are various developments in healthcare, like we talked about, starting from its emergence in the 17th century, when the discussion actually started. Now in the 19th century, the public healthcare system actually was born, because the discussion on the public systems started happening in several sovereign states. And also the expansion of federal activities also started in the 20th century, where a lot of governments actually started creating what we call a universal healthcare system, and the recognition that healthcare is a very important factor in our society, because what could affect the education from the pandemic taught humanity that what affected the low-income earners can also affect the high-income earners when it comes to communicable diseases. And also the recognition of the basic right of health, starting in the 21st century, where it is recognized as a human right to be free from any kind of disease, or actually seek for medical care if you become sick. Now, healthcare systems also vary from different sovereign states and sovereign countries across the world. Now there are power structure that actually undermine some healthcare system, actually orchestrate the kind of healthcare system that exists in a country. There are political stability and also financial resources. These are some of the factors that make up healthcare systems and administrations in several countries of the world. Thank you.